Good morning to everyone, to Lázaro Manuel, who joins us today, to the sign language interpreter, and the audience tuned in to this briefing. Today, we report 1,617 hospitalized patients, 84 under medical supervision, 959 are suspected cases, and 574 are confirmed active cases. Yesterday, again, over 7,000 samples were processed, 7,758 to be exact, at the molecular biology laboratories of our country, 2,384 at the Tropical Medicine Institute Pedro Coury, 904 in Havana's Hygiene, Epidemiology and Microbiology Center, 709 in Villa Claras. Santiago de Cuba's increased its processing to 376. 564 samples were processed in the Genetic Engineering and Biotechnology Lab, 498 in the Center for Molecular Immunology, 452 in Manuel Fajardo's hospital, 450 in Hermanos Almejeiras Hospital, 395 in the Naval Hospital, 370 in the National Civil Defense Labs, 321 in Fructuoso Rodriguez Hospital, and 254 in ICA's laboratories. As a result of the analysis and processing of these 7,758 samples, 77 people tested positive for COVID-19. This brings the total number of samples processed since the pandemic began to more than 500,000, 500,285 exactly, of which 4,803, or the 0.96% of all people, have been diagnosed with the virus. Samples from all of the country's provinces were tested depending on its epidemiological complexity. Pinar del Rio analyzed 292, Artemisa 347, Havana the most with 4,822, Mayabeque 226, Matanzas 347, Villa Clara 226, Santi Spiritus 167, Ciego de Ávila, the other territory that presents a complex epidemiological situation, processed 995, Camagüey 106, Santiago de Cuba 149, and so forth from every Cuban province. The 77 diagnosed cases are Cubans, 66, or the 85.7%, are confirmed case contacts, and were already in isolation units. This figure therefore means that the 89.5% of all diagnosed cases in Cuba have had contact with someone who had previously tested positive to the virus. The source of infection linked to 11 patients is yet to be determined, for a total of 69 over the last 15 days whose source of infection is being investigated by our specialists. None of the 77 patients contracted the disease abroad, so the figure of 434 imported cases remains unchanged as of today. 44 patients are male and 33 are female, what represents the 49.7% and 50.3% respectively. There are not significant differences in this regard. 57 of the 77 diagnosed patients, that is 74% of all cases confirmed yesterday, were asymptomatic at the moment of the test, what represents the 58.9% of all confirmed cases in Cuba up to date. If we look at the last 15 days, the figure slightly increases to 62.02% that have not presented any symptoms at the moment of testing. By age groups, 3 individuals are under the age of 20 and belong to pediatric ages, what stands at 491 patients diagnosed in this group, of which 86.3% or 424 are recovered from the disease. 29 patients are between 20 and 39 years of age, 30 between 40 and 59, and 15 patients exceed 60 years of age. Of the 77 diagnosed cases, 33 belong to Ciego de Ávila, 31 to Havana, 7 to Santi Spiritus, 3 to Camagüey, 2 are from Artemisa, and 1 case belongs to Matanzas. The 77 cases are a result of local transmission. We do not report any imported cases today. The 2 cases from Artemisa belong to the municipality of Candelaria. In Ciego de Ávila, 18 belong to the municipality of the same name, 7 to Majagua, 4 to Morón, and 4 to Venezuela. In Santi Spiritus, 4 cases belong to Jatibonico, and 1 each to the municipalities of Yaguajay, Trinidad, and Santi Spiritus. In Camagüey, the 3 cases belong 1 each to Sibanicu, Vertientes, and Florida. Matanzas reported 1 case from Cárdenas, which is linked to the transmission event detected in this municipality. The 31 cases from Havana belong 4 each to the municipalities of Cerro, Boyeros, and Arroyo Naranjo, 3 each to 10 de Octubre, Regla, and Centro Habana, 2 each from Guanabacoa, San Miguel, and Playa. The municipalities of Plaza, Habana Vieja, Habana del Este, and La Lisa reported 1 case each. I will ask Leonardo's support to bring up a map that presents Havana and Ciego de Ávila's epidemiological situation. As I mentioned, there's a significant spread of the virus in Havana province. We can see the transmission events detected in Plaza, Boyeros, Regla, 10 de Octubre. We are able to see the 4 events currently opened in Arroyo Naranjo, also in Lawton, Cerro, and Cotorro. In Ciego de Ávila, there are many events in the north, south, and center regions, as well as in Majagua Municipality, Venezuela, Baraguá, and Ciro Redondo, which are being less affected. But, as can be illustrated, the most significant amount of cases are from the municipality of Ciego de Ávila. Therefore, Ciego de Ávila's confirmed rate per 100,000 inhabitants is the highest in the country, with 45.07, Havana's 28.97, Artemisa's 10.88, both of them lower than the previous day. Santi Spiritus' rate increased to 4.51, Matanzas similar to the day before with 4.17, Mayabeques decreased to 2.34, the provinces of Pinar del Río with 1.37, Cienfuegos with 0.49, and Holguín with 0.2 remain with similar rates. Camagüey's rate increased to 0.78. Thus, Cuba's rate per 100,000 inhabitants increases to 6.57. With this analysis of the 4,803 diagnosed patients in Cuba up to date, 574 are confirmed and hospitalized active cases, that is 11.9%, of which 558, or the 97.2%, present a clinically stable evolution. We did not report any deceased as for today, hence the figure of 108 COVID-19 related fatalities remains unchanged. This means that the island has a mortality rate of 2.24%, lower than the global rate of 3.18% and the regional rate of 3.44%. We always mention the 2 evacuated patients at the start of the pandemic. Yesterday, 79 patients were discharged from hospital, a positive indicator. 54 are from Havana, 12 from Artemisa, 4 from Matanzas, 3 from Granma, and 1 each from the provinces of Santi Spiritus, Ciego de Ávila, Camagüey, Holguín, and Santiago de Cuba. Thus, we accumulate 4,119 patients, or the 85.8% of all diagnosed cases in Cuba recovered from the virus. 6 patients are in a critical state, 10 are in serious conditions. All of them are hospitalized in Havana, Ciego de Ávila, and Camagüey. One patient reported a serious passed to the critical state. One hospitalized patient joined the serious condition. Two patients previously reported as serious are now being closely monitored. Finally, I will ask Leonardo's help to bring up the updated chart that shows the indicators of deceased and mortality rates per month. As you can see, in this month, as of September 15th, we have reported 738 confirmed cases, 11 fatalities, and a mortality rate of 1.49% up to date. August's mortality rate was 0.56, July's 0.35, and June's 1.13. Thus, September presents the highest mortality rate in the last 4 months. Concerning worldwide statistics, COVID-19 pandemic remains to be present in 185 countries. 246,000 people were diagnosed with the disease only yesterday, for a total amount of 29,049,134 infections. 3,775 fatalities were reported only yesterday, what brings the death toll to 924,706 and a mortality rate of 3.18%. The region of the Americas continues to be the epicenter of the pandemic and stands at 51.41% of worldwide cases, with 87,888 infections in one day and a total amount of 14,935,345 infections. 1,639 deaths occurred in our region yesterday, for a total of 514,860 fatalities and a mortality rate of 3.44%. The United States continues to top the list of the worst affected countries by the pandemic, with over 6,519,000 diagnosed cases and 194,700 COVID-19 related fatalities. India follows with 4,846,000 cases. Yesterday, 1,136 people died from the virus, for a total of 79,722 fatalities. Brazil, with 4,330,000 infections and 131,625 fatalities. Russia, with 1,062,811 infections and 18,575 deceased. Turning our attention to the Americas region, after the United States and Brazil comes Peru with 729,000 cases, Colombia with 716,000 cases, then comes Mexico, Argentina and Chile, and so on. This is all the information on the behavior of the pandemic in Cuba and the world.